Hello YouTube, this is Robbie Williams and welcome to Rebirth. I want to say hello to all of my subscribers, my viewers, my family, and my friends. We're back to talking health again. Okay, let's go ahead and get started. Today we're going to talk about being health conscious. So, what is it to be health conscious? What does that mean? Well, to be health conscious is an attitude in which one has the awareness or wherewithal of the healthiness of his or her own diet and lifestyle. It's an awareness or a level of awareness in which you know what's wrong with you. Everybody have medical issues. And whatever that may be, you take it upon yourself to make sure that you're getting the right treatment, you're following the right diet, and you're living a lifestyle that is appropriate for how you take care of yourself and maximize your health. So, let's remember, in America, in today's America, we are fighting to bring health back to all families and all people alike. America is struggling to get people to get on a fitness kick, to get on an awareness of their health, to try to live better, and to try to make sure that they're doing everything possible to live a healthy and fruitful life. But for some reason, America is one of the worst countries when it comes to health care, health conscience, health awareness, and even access to health care. Not to say that we're not working on it. However, I think that there's times where we must be our own policeman. And what I mean by that, you need to take your level of awareness about your health to the next level. Taking it to the next level means following up with doctor visits, asking questions at doctor visits. Sometimes you may need to write some things down in order to prepare yourself so that once you meet with your PCP, primary care physician, you are ready to engage in a conversation that is fruitful and that will be pertaining to tailoring your lifestyle to better health. Okay, there are some things that I looked into that I want to make mention here. And so I looked at some of the problems that we're suffering from. And I'm talking about all Americans. Some Americans more than others. But we're gonna bullet point a few things, starting with high blood pressure. Now, high blood pressure is just a layman's terms for hypertension. Just a simple change in lifestyle can either prevent hypertension or it can limit those down times, those hard times that hypertension may bring. When your blood pressure goes higher than normal, it can be for many reasons. And just remember, as a note, there are so many Americans suffering from hypertension. And it states that by research, over 3 million cases per year are registered. People being diagnosed with hypertension. Now, African Americans are at a higher risk, whether it's due to lifestyle, whether it may be based on environment, and then you got to throw in hereditary, passed down from great-grandfather, mother, father. So it can be things that a lot of times we may overlook. But African Americans has the highest risk for hypertension than any other ethnicity. Reasons for hypertension can be things that you can change as an individual. For one, sitting around doing nothing, what some people call laziness. If you can take 30 minutes of your time, you may get out in the yard, do some yard work, raking, or just picking up leaves, just cleaning up the yard, or pushing a lawnmower rather than riding a lawnmower. If you don't have much yard to cut, why get on a riding lawnmower where you can push that lawnmower? That'll help you. That's exercising. That will help you with that hypertension. That will bring it down. Overindulging in alcohol. Some people like to drink socially, but there are some people that goes over the top. Those of you that like to go over the top, you're setting yourself up for hypertension. You're placing yourself in a risky situation. So take your time, get your buzz, just lay back. You don't have to overdo it. So be careful with how much alcohol intake and your consumption. Just take it easy, back off of it, because that's a sure way of ushering in hypertension. Eating too much salt. Now that's one of the things that I'm kind of working with. You know, I love salt on my food. So every time you have, there's a plate in front of me, I may have my salt and my pepper, and I'm going about my business. I'm saying, but I try not to overindulge, and I try not to intake too much salt. Here's the reason why. Taking in too much salt has an effect on your body. When your body feels that, it retains water. And what your body does, it holds that extra water, and that extra water causes your blood pressure to rise. So that's another one that you need to be careful of. Too much salt in your diet. Stress levels. Number one, we all got to work. And some of our jobs can be stressful. That's one thing that you can only change by changing jobs, or maybe change how you approach situations on jobs. That's one that you probably going to be with for a minute. But think about this. There's other time when you place yourself in stressful situations. You need to back away from it. There are a lot of times there are people that can stress you. Certain friends that when they come around, you get into these little heated debates, or sometimes things just don't jive right. We all have those times, but here's what you have to do. You have to find your time to de-stress. When you stressed, overly stressed, it can cause your adrenal glands to produce hormones that increases your blood pressure. This is something that you have control of because you can avoid some stressful situations. You don't have to be involved in everything that heightens your level of stress. So that's another one. De-stressing. You can go for walks. You can do things that will calm you. Keep that stress level down. That's stress. Now let's move to high blood sugar is another one that you need to focus on. And this is something that people that are health conscious, they focus on. They have high blood sugar, they know they have it, but they do the necessary things that it takes in order to make sure they keep their blood sugar low. So, what do? They make sure they monitor their blood sugar. They make sure they monitor what they eat. And they make sure they make their appointments with their PCP. These are the things that people that are health conscious will do. Another word for health conscious, another word for high blood sugar is hyperglycemia. So knowing that, when you hear the term, you know that it coincides with high blood sugar. Now this occurs in the body when the body doesn't produce enough insulin. High blood sugar or hyperglycemia primarily affects people who have diabetes. Remember, according to the CDC, Center for Disease Control, 80,000 deaths a year are due to the disease of diabetes. So this is a disease that really takes people out by the numbers. So this is more the reason to raise your level of health awareness. Another one, this issue is one that America has really been fighting with. And this issue is obesity. You see it all on the news. You see it everywhere. Just like you do hypertension and high blood sugar. You see that they're talking about obesity in children now more so than ever. Because kids, they're more likely in homes playing games rather than outside playing baseball or football, running and all that. You got more kids that are at home playing video games. Not blaming video games for anything. It's the lack of exercise. That's what it is, the lack of exercise. So, when you're focusing on your weight, that's being health conscious. Obesity, just for a definition, it is weight that is higher than what it is considered as a healthy weight for the given height of a person. For an example, I'm about 6'3". My normal weight, according to my BMI, body mass index, should be around 198 pounds. Now, I weigh about 215 pounds, so I'm a little over. That can be considered obese because I'm above the level that my BMI chart says I should be. Now, when you want to There's a BMI calculator that you can find online, and you can check your own body mass index. This is just pushing health awareness here. This is when you're being health conscious. So you can check it anytime. You don't have to go to a doctor. You don't have to go to a healthcare professional. You can check it on your own by knowing your weight and knowing your height. Research has shown that obesity is a very, very complex health issue, and it stems from many contributing factors. Hispanics, about 47% of Hispanics are obese. 46.8% of African Americans are obese. Now, when we're talking these type of numbers and percentages, these numbers are high. So when you think about obesity, right now Hispanics and African Americans are at the top of the charts. We need to focus on our level of health consciousness. Moving on to how different places are focusing on health. You have the Huff Post. They took a poll back in 2012, and they were looking to find the top 10 most health conscious cities in America. What they found were Texas, Austin, Texas, being number 1, Orlando, Florida being number 2, Denver, Colorado at number 3, Washington, D.C. at number 4, and Detroit, Michigan at number 5. Those are the top 5 in 2012. These rankings were created based on a percentage of preventive care, looking at the preventive care, looking at appointments booked versus appointments made. So these appointments booked are the ones that shows the attempt to go to your appointment, but then when you actually make the appointment, they showed up. So that's how they looked at those. Moving to 2019, another group did research on it, and they found WalletHub worked with a university, and they were looking for the top 10. And what they found was San Francisco, California as number 1, Seattle, Washington, number 2, San Diego, California, number 3, Portland, Oregon, number 4, and number 5, Washington, D.C., again within the top 5. Now their data was compiled and compared to more than 170 of the most populated cities across the U.S., with 42 key indicators looking for good health. Now the data ranges dealt with the cost of medical care, looking at the consumption of fruit and vegetables, and also going to fitness clubs. These things are important when you look at how it shifted from 2012 to 2019. Only DC remained in the top 5. So that shows that DC shows that they are more apt to following those diet plans and focusing on their health awareness and just trying to stay in it, when others may start one year and then fall off the next, may come back another year, what have you. But that's a gap now. We're talking about a good 7-year gap maybe. So 5-year gap. And we're looking at maybe how some people can stay within that top 5 or top 10 bracket versus dropping out. This is knowledge that we all should be looking for now to better the health of America. And then when you talk about better health, looking at yourself, focusing on yourself, and doing the things that you need to do to upgrade yourself by becoming more health conscious. One thing that I know that I read once in a biblical narrative, there's a biblical narrative that talks about knowledge. And Hosea 4 and 6 states that many of my people will perish due to the lack of knowledge. I don't think it's much of knowing, but it's what we don't know that hurts us the most. I hope you understand this video. I hope you listen and taking in what we gave you. This is Robbie, coming from Rebirth. Like, subscribe, come back for more content. I thank my viewers, and I also thank my subscribers.